Hi, my name's Chris and I work in the Women's Health Physiotherapy team in Swansea Bay University Health Board. I hope you'll find this video on vaginal laxity and prolapse informative and gives you some helpful advice and tips on how you can manage this problem. Firstly, what is a prolapse? This is where there's a change in the anatomy, where one of the pelvic organs moves downwards in the vagina due to laxity of ligaments and the pelvic floor muscles. It's often described as heaviness or pressure underneath or a bulge feeling. The prolapse may cause bladder, bowel, or affect sexual function. What causes vaginal laxity and prolapse? It is a common occurrence and it can affect 1 in 3 women who have had children. Being overweight will increase the pressure down through the pelvic tissues. In menopause, the drop in estrogen also affects the tissue laxity. Heavy lifting, where you're putting constant strain through the pelvic floor, will also increase vaginal laxity and affect the prolapse. It can run in families, and as we age, our tissues have more laxity. With constipation, this puts pressure through the pelvic floor as we strain to open the bowel. And any history of previous surgery may influence the tissue laxity. There are recognised types of prolapse which involve the different pelvic organs. The first picture on the left shows the normal anatomy. The second picture demonstrates the front vaginal wall prolapse, also known as a cystocele. This is the most common, and this is where the wall supporting the bladder bulges into the vagina. This may increase bladder symptoms. The third picture shows a back vaginal wall, or also known as a rectocele. This is where the supporting wall of the bowel bulges into the vagina. Bowel symptoms may be experienced as a result of this. The final picture shows the uterine or womb prolapse. This is when the womb drops down in the vagina. So how can we improve the symptoms of prolapse? Lifestyle factors such as weight loss, avoiding heavy lifting, pulling or pushing that requires effort, avoiding constipation and straining, taking regular short rests lying down to reset the prolapse, managing a chronic cough, and avoiding high impact exercises. Pelvic floor exercises will also help support your symptoms. So, what treatment options are available? You can take a wait and see approach, as a prolapse is not harmful or life-threatening. The use of pessaries, which are rubber rings or silicone rings which are inserted into the vagina, will help support the tissues of your vagina internally. Using vaginal creams which are estrogen-based, such as Vagifem, will also help replenish the tissues. Or using vaginal lubrication if you have dryness. Products such as Yes Silk, Hydromol, Medihoney or Replens are available on the market. Should the conservative approach not change your prolapse symptoms, then surgery may be advised. Further management advice for bladder and bowel can be found in videos 2 and 3. How to exercise your pelvic floor is in the next video, video 5. The links provided below will offer further information. I do hope you've enjoyed this video on how to manage prolapse and laxity.